Hi, I'm Sal Picataggio, immigration attorney at Colombo and Hurd, and this week we have two big developments in green card eligibility for foreign doctors. So, the path to U.S. residency for foreign physicians has long been a series of obstacles, leading to a dead end for many. With limited options to obtain even a temporary visa and burdensome requirements to reach for a green card, many foreign physicians are simply not able to help fill the healthcare provider shortage here in the United States. Making matters worse, or at least more confusing, was President Trump's tweet on April 20th calling for a temporary suspension of immigration, causing concern among many that needed physicians and other healthcare workers would face even more barriers to entry. However, as it turns out, the text of the president's executive order carves out some exceptions for physicians and healthcare workers. And at the same time, some U.S. states have significantly eased licensing requirements so that foreign physicians could immediately move to obtain licensure in that state. So, as the number of COVID 19 coronavirus infections keeps rising, the United States is struggling to maintain a full supply of medical professionals to fight the pandemic. And both the federal government and the states that are coronavirus hotspots are taking steps to address the shortage of doctors and other healthcare professionals. So far, the most significant steps have come from the state of New Jersey, one of the states that's actually hit hardest by the COVID 19 crisis. On April 17th, it was reported that New Jersey Governor Phil Murphy has issued an executive order to expand the physician workforce during the COVID 19 crisis. Governor Murphy declared it to be in the public interest to temporarily authorize the practice in New Jersey of foreign doctors in good standing in other jurisdictions. Through Governor Murphy's executive order, New Jersey state authorities can now issue licenses to practice medicine and surgery on a temporary basis for the duration of the state of emergency or public health emergency to any physician who is licensed, in good standing, in another country, and who has engaged in practice for at least 5 years and clinical practice within the last 5 years. So, to facilitate the issuance of emergency medical licenses to foreign licensed doctors, the state has temporarily suspended the requirements pertaining to examination for licensure, to pre-medical education, to additional education, to examination and other fees, and to medical malpractice insurance coverage. Other states have also taken steps towards easing the licensing restrictions for foreign educated doctors to address the rising shortage of medical professionals. At the end of March, New York Governor Andrew Cuomo issued an executive order allowing graduates of foreign medical schools who are not yet licensed in New York, but who have completed at least a year of US-based medical graduate education to begin to provide patient care in hospitals. And Nevada Governor Steve Sisolak authorized the chief medical officer of his state to approve the waivered exemption of professional licensing requirements for providers of medical services who have received training in another country but are not currently licensed in the United States. Now, the implications of President Trump's proclamation and executive orders like Governor Murphy's and Governor Sisolak's are very significant for foreign physicians and healthcare providers seeking to apply for U.S. permanent residence under the EB-2 National Interest Waiver. It's a process we first wrote about several weeks ago, and you can find a link to our article on the topic in the description below. The EB-2 National Interest Waiver provides a path to U.S. permanent residence for the foreign professionals who possess a U.S. or foreign equivalent advanced degree, like a doctorate, or a master's, or even a bachelor's degree and 5 years of progressive experience, and who are able to show that their proposed endeavor has substantial merit and national importance, like combating COVID 19, and that they are well positioned to carry out this endeavor in the United States. So it's not a legal requirement in the standard EB-2 NIW application that you have a medical license, but having a medical license in the United States can help the foreign doctor show that they will be well positioned to carry out their endeavor in the United States. So these recent state actions are big steps towards successfully arguing this part of the NIW process. All in all, signals from both the federal and state governments highlighting the national importance of combating COVID 19, as well as the rapidly growing shortage of medical professionals in the U.S. and these new licensure requirements, may make for stronger evidence that the foreign medical professional is indeed well positioned to actually contribute and may make for a stronger overall EB-2 NIW case. If you're a foreign trained medical professional that meets the above criteria and are interested in developing your career in the United States, contact the experienced United States immigration attorneys here at Colombo and Hurd. We have extensive experience in representing physicians and healthcare workers in the EB2 NIW process and other processes like the EB1 Extraordinary Ability. You can also visit www.colomboheardlaw.com to contact us for a consultation and to see our most recent articles on this topic. Thanks for watching and take care.